Can you all see my screen?
Yes, we can, Michael. If you're able to make it a full screen, the best, but well, good in. We can see it, Michael.
Okay, okay. It is full screen, I presume. Okay, so thank you very much, Bao. Thank you for the introduction. I am Dr. Michael Onyango, a young pharmacist, as Bao was said, and I am lucky to be working for a great organization, an organization called MedSource. So allow me to quickly take you through what we do at MedSource. And it is exciting that we are talking about supply chain and especially around financing of health products and technologies. And MedSource, we so happen to be in the perfect midst of that. So allow me to say that in terms of costs and health products and medical costs, the patients in Africa tend to spend more on medicine. And this is due to a number of reasons. And when the cost of healthcare goes high, then again, what is usually the first culprit is the supply chain process. And when the supply chain process is not as efficient as possible, then the cost of products will automatically be high. Now, in Kenya and Africa in general, we have a pharmaceutical supply chain that is experiencing fundamental shortcomings. And now these shortcomings have sort of led to system failures that now affect accessibility and availability of quality and affordable healthcare products and technologies. And now quickly, let's appreciate the supply chain space as it stands. And just so to say that the current pharmaceutical industry has a lot of potential, especially the African market. We estimate the size of the East African pharmaceutical market to be about 5 billion. And it is estimated to grow at a rate of about 10 to 12% over the few coming years. And there are a lot of products, again, trading in this space. But now, what happens in this supply chain space is that we have about, especially in the Kenyan story, we have about 70% of the products in this market being imported, and then about 30% being supplied by the local manufacturers. Now, after the manufacturers tire, we move to the distributorship phase, where now it is highly fragmented with several players in this space. Now, what happens is when you have a lot of players, again, in the distributorship space, you have a lot of intermediary margins being added across the chain. And this in turn increases the cost of healthcare, because when you have so many distributors, each will add a margin, and finally the cost to the final person in the chain, the final retailer, the cost of a particular product ends up being high. Now, what has a highly fragmented system or a fragmented supply chain system led us to? It has led us to different structural challenges across the supply chain. And now we have high supply chain costs, high product costs. This system has led to lack of product traceability, because there's so many players in this space. Some of them do not keep proper systems, and now traceability becomes a problem. Again, adoption of technology has been low in this space. This has also led to now demand for high capital when you want to start or do your business in this space. So there is need for high capital. Now, due to this high fragmentation, again, now we lack reliable market data. We cannot properly trace, analyze, and use the market data we have. Again, now due to this high fragmentation, we have had cases of falsified and unregulated medical products infiltrating the market. So, and now due to these are challenges that after we did a proper market study, we realized that our supply chain processes are not streamlined, it's not efficient, and therefore these challenges are affecting our patients, and now our patients are unable to properly get quality and affordable medicine. Now, let me take you to what MedSource is and what we're doing as an organization. And basically, MedSource is it's a tech company that is coming into the supply chain space with certain solutions to ensure that we have access to quality and affordable medicines to the last mile. And if you look at our Kenyan story, the first point of care are usually our pharmacy and our mid-sized hospitals. Now, we want to ensure that these facilities down there that are serving the common man down there are accessing quality and affordable medicines. And we are doing this with the help of technology. And so as MedSource, we brand ourselves as a group purchasing organization, and I'll describe what that is as I'll be describing our products and solutions. So we are currently in about, our footprint is in about 38 counties in Kenya, and we hope by the end of the year or in the coming year, we'll capture the entire country. So this means we operate in about 80% of the country. And now quickly through what we provide in the space of supply chain. And we keep saying that we are here as an organization to streamline the healthcare product supply chain space. And we bring with us several goodies to ensure that we streamline this area based on providing to the solutions that to the challenges I have mentioned earlier. The previous speakers have talked about the importance of using technology to streamline our supply chain processes. And I think as an organization, we are among the pioneers trying to do this in the market, trying to use technology to improve health products and technologies, accessibility, and also affordability. Now, I'll quickly take you through a few of our products. And as I've said, now MedSource being a tech company, we've created an online procurement platform. Prof in his talk, he just talked about e-procurement. And now, as MedSource, we've created such a platform, and we've created an online procurement platform, which is a simple and a flexible online pharmaceutical marketplace. And this marketplace, essentially, it connects distributors or the suppliers, and suppliers being our distributors and manufacturers, to the healthcare providers, who are hospitals, clinics, pharmacies, who are essentially providing care to our patients. Now, this digital marketplace comes with a lot of advantages. The first thing it does, it automates the supply chain process. And when the process is automated, it creates efficiency. And so we are able to provide a proper marketplace that has visibility and traceability. And this is in terms of pricing, and even where you're sourcing your products. So on this platform, when a pharmacy or a hospital uses this platform to order for their goods and products, what they will see is they're able to know where they're sourcing their products from in the first place. They are able to do a comparison between different suppliers. They are able to see the pricing structure of different suppliers. And what this does, it brings about visibility and transparency of pricing. Two is traceability now, because it's a digital system. You can trace a product from where it was sourced to who you bought it from to how it landed to your facility. And third, we also ensure that now the products that are being traded on this platform are quality products. And with this, how do we ensure quality? We do this by ensuring that the suppliers we have on this e-platform are pre-qualified. We even go ahead and do pre-qualification tests in collaboration with MEDS. They just explained how they do that in their presentation earlier. And so we ensure that all the products that are trading on the MedSource platform are properly registered products. The suppliers on this platform are pre-qualified suppliers who adhere to proper medical supply chain and trade practices. So in that sense, the products that our members who are buying through this platform, the healthcare providers, the pharmacies, the hospitals, the clinics buying through this platform, at the end of the day, they are able to access quality products. Now, moving forward to data and the need for tech solutions and also for proper market data cannot be overemphasized. And most of the speakers who've spoken before me have really brought this point up, that we need a proper data collection, analytical and presentation tools and products so that we are able to carry out an informed supply chain process. And as MedSource, we pride ourselves to also be in this space where we are trying to collect data and for customers who are trading with us, we are trying to give them proper data that will inform their business, that will help their businesses. And what we are doing on our e-platform, those interacting with our e-platform are able to generate different kinds of data. They're able to get different kind of analytics that inform business, that inform procurement. And in general, whatever we collect as an organization in terms of data will now in turn inform how we respond to different supply chain requirements of our hospitals and pharmacies. Now, our e-platform again provides procurement convenience. It is easier to use. It is very user-friendly. And as I have said, it gives you access to a variety of suppliers. Again, we use the group purchasing organization model where we bring people together, hospitals, pharmacies, and clinics together, and we leverage on economies of scale to negotiate for better pricing. And so in turn, the facilities interacting with our platform are able to get products at a fairly better price. And so just to quickly move to our value proposition to the different players interacting on our e-platform. We have manufacturers and distributors. And what do we offer them? We give them market access. And as I've said, we are operating in a group purchasing organization model. And so we've created a market space for the manufacturers and these distributors. So we give them good market and easy market access. We give different data analytics that inform their supply chain processes. We also offer financing options, and I'll speak to that in a bit. We try to, again, bring the cost of products down to ensure that the manufacturers and distributors are able to supply to customers or sell products to the different retailers at a fairly cheap price. Now, to our customers, we call them members. the people who form the MedSource group, the hospitals, the pharmacies, and the clinics that buy through our e-platform. Now, we've created a very simple and a convenient procurement platform for them. We are promising better pricing for them because we're leveraging on the economies of scale. We also do different capacity building for them. We realize that if you look at we pharmacists, we are from a background where we are trained on health and how to respond to patient needs. But when it comes to running businesses, we have a few shortcomings. And so we are trying to, again, build capacities around that. How do we run proper businesses? And also when it comes to supply chain management, how do we do proper inventory management? How do we do proper forecasting? How do we do proper stocking? So we do a lot of capacity building around that as well. And also we offer different data analytics that will inform business processes, and also different digital solutions that we are in the process of developing that will make the supply chain process or the retail and hospital management processes easier when it comes to supply chain. Now, and finally, to our patients, what we are trying to do, because at the end of the day, we are here to serve the patient, and we are promising the patient lower cost of health, access to quality medicines and products, and generally access to quality healthcare. And so we've created as a platform where there's mutual benefit between healthcare providers, healthcare product suppliers, and finally to the patient. Now, finally, to speak to the theme and the theme of this event, it was financing health products, technologies, health products and technology supply chain. And as MedSource, we sort of realized there is a need in the market to provide a financial solution. We realized that most facilities, and this talking about pharmacies, hospitals, they require access to some form of credit. Now you realize that again, creditors in the market, especially the banks, have been shying away from the healthcare space. And this is due to a number of reasons. First of all, most of them do not understand how the space runs. The form of credit that has been in this space, again, comes from the distributors or the suppliers. And then again, most of our facilities are sort of deemed unbankable because, again, we are not properly trained on how to keep our books, how to do different financial plannings that if we share with the bank will deem as bankable and extend credit to us. So we realized there is a need in this market for financing. And so we came up with a product and we call it inventory financing. And what is this? We call inventory financing. It is basically an unsecured credit line. And it is a credit that we give to our buyers, and that is our members, the hospitals, the pharmacies, the clinics, and we give them credit to help them in buying the health products they need. Now, it is again tied up into our e-procurement platform, our digital platform, and so there are no cash disbursements that we give to the members. It is sort of money that is tied up in a wallet somewhere, and you are able to access it. So when you need to buy your products, you shop on this e-platform, and once you're ready to pay, when you submit your order to a particular distributor, we immediately pay the supplier. Now, what does what advantages do this bring? One is we ensure that the customer has, again, access to capital. And the customer is able to buy whatever they need at a particular time. Two, we ensure that the supplier is promptly paid because we pay them immediately. A customer submits a particular order. So we ensure that the customer has, the distributor is liquid enough because we pay them promptly, and therefore their money is not tied up in form of credit with the different facilities. So they have the money to restock, and therefore this improves availability of medicines. Two is, again, now with this product, we are able to negotiate for better pricing from the distributors and ensure that our member organizations have better pricing, have better product prices. And again, also, finally, this model creates sort of a point of entry for different financial.
Daktari, you've muted your mic.
Oh, sorry. So again, with this product, we are sort of inviting different financiers to enter into this space. I just mentioned earlier that our banks have been shying away from financing healthcare providers. So with this model, we're sort of creating a perfect entry point for them to come and help us finance our inventories. So I think I'll leave it at that, and I'll leave the remaining time for questions. Thank you, Mbao.